Balance Hypnosis are experts in hypnosis for pain management, and we're based in Nottinghamshire, England. So what kind of pain can hypnosis help with? Well, all kinds of pain, but in particular, one of the biggest areas that we see our clients in is people who are suffering from chronic pain. That means that they've had that pain for months, if not years, way beyond the period where you would have expected their bodies to have healed and to stop feeling that pain. Some people may have had the pain relatively recently, so for example they'd had an operation and we would have expected that pain to stop within a few days or weeks, and it hasn't. Or maybe they've suffered from that pain for many years. Although pain and chronic pain is the main reason why people come to see us, we can help with short-term issues as well, and we'll go into those in a moment. So these are just some of the types of pain that we can use hypnosis with. Cancer pain. Now, we are not here to say that we cure cancer, absolutely not. But we can help people to deal with the pain aspect that they may be feeling with their cancer. And in many cases, we're able to reduce the pain that they're feeling. The same for fibromyalgia. Headaches and migraines, if you think about it, makes sense. Many people have these because of tension. If they can learn self-hypnosis and start to relax, the headaches and the migraines start to fade away. And that's often the case when you see back, neck and shoulder pain. I've already said post-operative pain, we can help to try and relieve that in the short term if we need to. Arthritic pain, and there are many people who specialize in dental hypnosis, anesthesia, to stop people feeling pain when they're having teeth out. And of course, any aspects of psychological pain, which we'll talk about in a moment. Hypnosis deals with all kinds, physical and the psychological aspects of pain. But before we see you, we want you to see your doctor, because we need a formal diagnosis as to why you are suffering from pain. Pain is there for a reason. It often is telling you that something isn't quite right. And sometimes that thing is relatively minor, for example, tension, and we're able to relieve that tension, and that helps with the pain, as in with headaches. However, sometimes that pain is there for another reason. Imagine now that the person who came to us with that headaches actually has a brain tumour, and we start to work with them to reduce the pain they're feeling. Well, you can imagine they will never maybe go to see their doctor to discuss the real issue that needs to be addressed. Hypnosis can mask effects of real serious issues, which is why we like a proper diagnosis to understand why you've got the pain before we treat you. Now, hypnosis will work differently for many people. There are many things you can do with pain depending on what the person is suffering with. For example, sometimes we're able to make the pain seem larger or smaller. That seems strange to people that we would want to make pain bigger. We only tend to do that in the very shortest of terms, just to show people that we can control it just through our minds in many cases. And of course, we don't leave it feeling larger, we instantly make it smaller. But if they can do large, they can do small as well. You can also move pain to other parts of the body. So let's say you have a persistent pain in somewhere that's really not useful to you. You can move it maybe to your little finger, somewhere where it's much easier to control. We can also use it for anesthesia. It has been well known that people can have operations under hypnosis without any need for pain control. And even though we don't tend to do many operations on our clients with doctors, it can be used in other methods to try and numb the pain. The distraction techniques we use in hypnosis can also alter people's pain perception. For example, if you were having an injection, users having that can help to make them forget that there's a needle coming in their direction. And we can also help you visualize changes to pain. And that means imagining the pain, for example, has a texture, a color, a feeling, and then altering that so it's something more palatable. When you do that, it often changes the effects of that pain. Even though that may seem a strange concept, there is often a psychological element to pain. And you'll find that if you look at the very beginning, the very first slide that I used in this presentation, you'll have noticed that the images and the headline of the presentation had contained the colour red. And it's interesting because when we see that red and when we see an image with someone with red radiating spots, we instantly think of pain. And if that colour was something else, pink, we probably wouldn't think the pain level was as high. We wouldn't even associate it with pain. So it just shows you, even by using colour or words or even smells, you can change the way a person thinks about pain. So if I get somebody imagining that they have a red dot, this radiating, pulsating dot that's causing pain, and then get to them to imagine it under hypnosis that that's changing, maybe getting smaller, maybe changing to a colour that feels calming and cool like blue, then you often find that the person will have a much lesser pain level at the end of the session. We also know that anxiety and pain are often closely correlated. The more anxious you are, the higher perception of pain. And many people will feel anxiety if they've been through an operation or been through a trauma. Their anxiety levels tend to be heightened. So when we work with people to relax them, to calm them, it will often reduce their perception of how bad their pain is as well. And you may find that is quite dramatic in many cases. We normally score our clients on a scale of 0 to 10. So 0 would be no pain and 10 would be absolute agony. If we have a person who comes into us who's anxious, they may report that their pain levels are around a 7 out of 10. But after a hypnosis session where they feel calm, where they feel much more relaxed, that can often drop to a 2, a 3. Sometimes it disappears completely. If you'd like to talk to us a little bit more about hypnosis for pain management, or in fact any of the other things that we work with our clients for, then just give us a call. We can be reached on 01 636 650 521, and we're always happy to have a chat with you so that we can discuss your problem.